What does HSDD mean for sexual desire? Imagine feeling a persistent lack of interest in sex that just doesn't go away. That's what hypoactive sexual desire disorder, or HSDD, is all about. It's a recognized sexual dysfunction where someone experiences a long-term or recurring absence of sexual desire or thoughts. This isn't just a low sex drive for a little while. It's a persistent issue that lasts at least 6 months and causes real distress or problems in relationships. If someone rarely or never thinks about sex, feels no motivation to engage in sexual activity, and this impacts their life or relationships, HSDD might be part of the picture. It's important to understand that not everyone with a low sex drive has HSDD. The key is whether this lack of desire causes significant distress or relationship difficulties. For example, if someone has a naturally lower interest in sex but it doesn't bother them or their partner, it's not considered a disorder. But if the low desire leads to frustration, sadness, or relationship strain, then it might be worth exploring further with a healthcare professional. HSDD can affect anyone, regardless of gender, but it is more often reported in women. It can be something a person has had since early in their sexual development, called lifelong HSDD, or it can develop later, known as acquired HSDD. The lack of desire can be general, meaning it's present in all situations and with all partners, or it can be situational, only happening with certain partners or in specific contexts. The causes of HSDD are quite varied. Physical factors like hormonal imbalances, medical conditions such as diabetes or thyroid issues, or side effects from medications can all play a role. Psychological factors are also common, including stress, depression, anxiety, past trauma, or relationship problems. Often, a combination of physical and psychological factors contributes to the condition. Treatment focuses on addressing these underlying causes. If hormones are involved, hormone therapy might help. Counseling or therapy can be very effective for psychological or relationship issues. Sometimes, healthcare providers may recommend specific medications approved for treating HSDD in women, but these should only be used under medical supervision. It's essential to work with a healthcare professional to develop a personalized plan. From a broader perspective on sexual health, it's important to note that HSDD is not an infection or a sexually transmitted disease. Instead, it's a complex condition that can impact overall sexual wellness and quality of life. Open communication with partners and healthcare providers is vital for managing HSDD effectively. Remember, seeking help is a positive step toward understanding and improving your sexual health. In summary, HSDD means a persistent lack of sexual desire that causes distress or relationship issues. It's a treatable condition, and professional support can help restore a healthier, more satisfying sexual life. If you think you might be experiencing HSDD, talking to a healthcare provider is the best first step toward understanding your situation and exploring options for improvement.